There's a hidden cause of heart attacks that no one talks about. According to this book, written by a medical doctor, Thomas E. Levy, and author of many other great books like Curing the Incurable, Primal Panacea, and Death by Calcium, there are over tens of research papers, if not hundreds, that shows that there's a direct link between your oral health and your chances of developing heart-related diseases. What do I mean by this? This means if you have any form of disease affecting your oral cavity, like periodontal diseases, dental caries popularly known as tooth decay, oral cancer, and oral thrush, which most of you know as candidiasis, there's a higher chance you will develop a heart-related disease. And to be specific, the research connected periodontal disease as the main oral health disease that can directly and independently increase your risk of coronary heart disease from the other known risk factors. Now, here's the science behind how periodontal diseases cause heart disease. But first, let's talk about how you get periodontal infections in the first place. Whenever you eat, food particles can get trapped between our teeth and along the gum line. Oral bacteria that are naturally present in our mouths feed on these food particles, forming a sticky film called plaque. Over time, if these plaques are not removed through brushing and flossing, it hardens into tartar. The tartar then builds up and irritates the gum, leading to inflammation known as gingivitis. If gingivitis is also left untreated, it progresses into periodontal disease. In periodontal disease, the gums begin to pull away from the teeth, forming pockets where more bacteria can accumulate. This leads to further inflammation and damage to the tissues and bones supporting the teeth. Your body's immune system tries to fight the ongoing bacterial infection and inflammation in the gums by releasing inflammatory molecules such as cytokines and chemokines, and immune cells such as neutrophils and macrophages. Now remember that the aim of your body's immune system is to fight off the oral infection, but this easily turns sideways as your immune system response becomes overactive and causes damage to your own gum tissues and the bones supporting your teeth. The inflammatory molecules and immune cells released in response to periodontal disease enter your bloodstream and travel throughout the body. Once in the bloodstream, these inflammatory molecules and immune cells can affect distant organs and tissues throughout the body, including the cardiovascular system with diseases like atherosclerosis, a condition where fatty plaques build up inside the arteries. These plaques can narrow the arteries and restrict blood flow to the heart. With time, the atherosclerotic plaques can become unstable and rupture, exposing its inner contents to the bloodstream, including cholesterol, inflammatory cells, and tissue debris. This triggers the formation of blood clots, also known as thrombosis, within the coronary arteries. If a blood clot becomes large enough to block the entirety of a coronary artery, then it can cut off blood flow to part of the heart muscle, leading to myocardial infarction, which we know as a heart attack. Now, if you think the whole idea of your oral health causing heart-related disease is scary, wait till you hear this. There was another study in the book involving 101 patients with heart attacks and blocked arteries. 78% of those patients, which is basically 79 out of the 101 patients, showed DNA evidence of pathogens typically found in infections related to root canal-treated teeth within the blood clots extracted from their arteries during medical procedures. Now, to clarify things, what this research is saying is even the act of treating a severely damaged tooth by removing the infected pulp from inside the tooth and sealing it to prevent further infection, you put yourself at a higher risk of attracting a heart-related disease. But the question is, why does this happen? Why does the simple act of saving a severely damaged tooth put you in such a dangerous position in life? Now, here's how it works. When someone decides to undergo root canal treatment, this is typically because they have a severely infected or damaged tooth that they usually identify after experiencing persistent tooth pain or sensitivity. During the root canal procedure, the dentist removes the infected or damaged pulp from inside the tooth, making it insensitive. Now remember this, the pulp is the part of the tooth that contains nerves, blood vessels, and connective tissue. After thorough cleaning and disinfecting the root canal space, the dentist fills and seals it to prevent further infection. But the truth is, it's extremely difficult to the point of impossible to completely eradicate all the bacteria from the root canal system. Some bacteria may remain in tiny tubules within the tooth or in surrounding tissues. These bacteria will basically multiply over time, leading to a low-grade chronic infection within the tooth. It doesn't stop there. These bacteria gradually leak out into the surrounding tissues, including the bone and the bloodstream through small blood vessels in the gums. Once in the bloodstream, they can travel to other parts of the body, including the heart, and cause blood clots that block the coronary arteries, just like the periodontal diseases would do, leading to a heart attack. Now, listen, the goal of this video is not to scare anyone. It's to give you the right information so you can decide what to do with it. With this video, it's extremely clear that you need to protect your oral health at all cost. So remember to do these things. 1. Brushing your teeth twice a day and flossing once a day helps remove food particles and plaque from your teeth and gums. This prevents bacteria from building up and causing infections. 2. Regular dental checkups are essential for detecting any dental issues early on. Your dentist can identify and treat cavities, gum disease, and other dental problems before they worsen and potentially affect your heart health. And remember this point, which is point 3. While root canal treatment can save a severely infected tooth, it's best to avoid it if you can. Weigh pros and cons of the other options your dentist presents to you. If you ever find yourself that position, now, if you experience tooth pain, sensitivity, or signs of gum disease such as bleeding gums, don't ignore them. Seek prompt dental care to prevent the spread of infection and reduce the risk of complications, including heart disease.